1.7 million people acquire infections in the hospital every year. 99,000 of these infections result in death. And roughly 1/3 of these deaths are preventable. The World Health Organization published an article on healthcare-associated infections that mainly come from poor healthcare compliance. They state, hand hygiene is at the heart of infection control, an essential procedure of universal relevance in healthcare. Hand hygiene is a simple, low-cost procedure, the impact of which can contribute globally to saving millions of lives. However, about 35% of healthcare workers forget to properly sanitize and touch patients with germ-covered hands like these. Now this can be prevented with a simple reminder. Introducing Notivibe, the next best thing in hand-washing compliance. This system, which will begin implementation in the neonatal intensive care unit, employs passive RFID technology in conjunction with a plastic wristband to increase hand hygiene compliance in a hospital setting, which will decrease the number of infections transmitted to patients. Let's take a look at how this system works. When a healthcare worker approaches the neonate in an isolette without prior sanitation, their bracelet will vibrate, notifying them to sanitize their hands. Then they must reach the lit-up sanitation system and sanitize their hands in order to stop the vibration. Now they can return to the isolette to continue to treat the patient. This system will remind, train, and encourage healthcare workers to sanitize at the necessary times, which will in turn increase hand hygiene compliance and reduce the number of hospital-acquired infections stemming from dirty hands. A notifying vibration system to increase hand hygiene compliance. Notivibe.